Hi, Miss Jill. I'm Jennifer, and I'm going to be doing an assessment of your musculoskeletal system, okay?
Okay.
So what I'm going to do is I'm going to start with your upper extremities. So I'm just going to look at your arms, and I'm going to raise these sleeves up just a little bit. And first, I'm just kind of looking at the overall color, and you're a nice kind of light tan, medium tan. And the surface characteristics, they're all smooth and even color, and I don't see any discolorations or anything like that. And then like we did in the skin, I'm looking at the temperature, and it's nice and warm. The texture, everything is smooth, even. I don't see any edema. I'm palpating for edema. I see good elastic skin turgor. I'm gonna come down, I'm gonna look at your hands and your nails, and I'm gonna assess for capillary refill just by pressing and releasing on the fingernails. And those look great, okay? So we've got a capillary refill of less than 2 seconds. Will you hold your 2 fingers like this for me? Okay, so I'm just looking for any clubbing, and I don't see any clubbing there. Okay, if you'll hold your arms out like this, I'm gonna check for pulses. So I'm gonna do brachial pulse here. Okay, and those are 3+, equal, and regular. And then I'm gonna feel for your radial pulses here. And these are also equal on both sides, about 3+ in amplitude, and regular. So that's great. Okay, so I've done edema and skin turgor. I've looked at the nails, and I think Nurse Debbie earlier talked about your fingernails, how they were clean and well groomed and well shaped and not too thick. They don't have any discoloration or anything like that. But if we didn't do that in the skin, we could come back and do that again here. So now what I'm going to do is a little bit of range of motion. And the first thing I'm going to do is passive range of motion. So passive range of motion is where I'm actually going to put my hand on the joint, and I'm going to move the extremity through the range of motion. So I'm going to put my hand on the shoulder, and I'm just going to take you around in a circle here, and I'm feeling for any crepitus, any deficits in range of motion, any tenderness. Is any of this sore? Okay. So we'll do the same thing over here. So no popping and cracking, everything's moving like it should. Great, so that's full passive range of motion. So now we'll do active range of motion, which is where you will actually do it. So I'll have you take your arms in a circle like this. Great, okay. Take the elbows up and down, okay. Take your wrists up and down and side to side. Fingers, take them out, and then make a fist. Perfect, so that's full active range of motion. We can also do range of motion in the neck. So I'm gonna have you bend your head forward, extend it all the way back, okay? Go side to side, perfect. And you can twist and look this way and look that way, perfect. And another one I can do is I can have you shrug your shoulders up. Great, and that is actually cranial nerve 11, which will be with the neuro stuff as well. So we've done active range of motion, we've done passive range of motion, and now I want to do a little bit of muscle strength testing. So what I'll have you do is hold your arms up like this. I'm gonna have you push towards me. Great, okay, pull back towards yourself, perfect, and then pinch my fingers for grip, perfect. So your muscle strength is a 5 out of 5. Okay, the things we did on your arms, we're gonna come back down here and look and see that her legs are nice and symmetrical and even. There's no obvious deformities. All the skin is even colored. I don't see any discoloration except for a little knee bump right there. The skin is warm, it's smooth, any of this tender, everything's nice and even. I'm palpating for edema. Foot and ankle edema is very common, lower extremity edema, and I don't see any edema there. She's got good elastic skin turgor here. Everything's nice and symmetrical. So again, for range of motion, we can have her kick her legs up and back. Perfect. Up and back. And have your feet go up and down. And you can take your ankles around in a circle. Another thing your faculty may have you do is they may have you kneel to the ground and squat. So we can do that in just a second when we do your back. Again, the toenails down here are nice and evenly shaped. Good hygiene. Normal thickness. I don't see any wounds or anything on the feet. I do have some pulses here in the back behind the ankle. This is the posterior tibial pulse. She actually has very good palpable ones. Sometimes these are hard to find. So these are, again, about 3+, regular and symmetrical. And then we have pedal pulses here on the top of the feet. We're feeling these simultaneously. Those are about 3+, regular and equal. I can check capillary refills on the toes as well. Ooh, these are cold from sitting on the floor. So she's got a good brisk capillary refill. Her toenails are painted, so I'm having to look at the like side of the toe. I could also pull up right here. Another thing that's important to look at on the feet is the back of the heels for skin intactness. And those look nice and intact. Okay, so for muscle strength, you will have her push against me. Great. Pull back. Okay. Push down like the gas pedal and then pull up. Perfect. And then I can also do passive range of motion, just feeling for crepitus. There we go. Any of this tender or anything? No. Everything is intact and non-tender. No crepitus or anything like that. Wonderful. Okay, so now Michelle, what I'll have you do is stand up, turn around, you can face that wall away from me. And normally what I would do at this point is I would uncover so that I could look at her back. But I'm going to let her stay modest since we're on camera broadcasting this to the world. And I'm looking to see, are her shoulders and hips at an even level? And I'm looking to see, is her spine midline? And I can palpate down her back here. And another thing I can do is, will you bend over and like you're going to touch your toes? Perfect. So I'm going to get behind her and I'm going to look to see, is everything nice and even and non-tender? Everything straight? I'm also looking at her balance and mobility when she does this. Okay, and you can stand up straight and you can turn around, face me. Are you able to squat just a little bit and then I'll take a look at the hip range of motion? Bless. Thank you. Okay, thank you.